joining, but welcome on this kind of cloudy, rainy day. This week was beautiful, but hopefully the weekend will be just as nice. So kind of, yeah, the end to our week is a little dreary, but it's okay. I'm Angie Brenner, and I have a few updates that I'm going to jump right into. We want to make sure that as we go through the presentation today, for everyone to please feel free to send any questions you have. Make sure you send your questions to all panelists, and we'll make sure to get those out and answer those the best that we can. Anything that we're not able to answer today, we'll make sure to get those out to you here in the next week. So I'll jump right in on the budget front. It's been a quiet week since it is spring break, so that's been kind of nice for everyone to get caught up a little bit. It will pick up next week when session is back in and going. And I think what it looks like so far is it will have markup next week. So we anticipate things getting busy again. In the meantime, even though it's been a little quiet on the budget side, our team has been working on waiver amendments for both the rate standardization as well as the value-based purchasing efforts that are going through General Assembly through the budget process right now. What will be key for us is for rate standardization to be approved in our waiver amendments by July 1st, so we can start those rate increases, that rate standardization on July 1st. And then for January 1st would be the implementation of the value-based payment structures that are in the governor's recommendations. So it is a pretty tight turnaround for us in order to get those approved timely. The waiver language, you're going to start seeing some movement and some public comment periods. It will be high level. We want it to be as high level as possible to get through CMS approval, but that also allows us that flexibility. And then we'll be getting further input with stakeholders on the details that will be included then in the provider contracts and policies. Examples of some of those details would be things like what makes sense to report, the timing of reporting, things like that. But really our most immediate goal is to get those waiver amendments out the door so we can have everything implemented on time. So that is kind of my quick update for today. So with that, gosh, I did that in like 2 minutes. I'm so sorry, that was quick. I'm going to go ahead and turn it over to Emily, so Emily can talk to us a little bit more about, or a little bit about our COVID flexibilities and the unwinding of those. So Emily, with that, I'll let you take it over.
Sure. Thanks, Angie. Hi, I'm Emily Lubring, and I'm with the Federal Programs Unit. And one of the things that we've been talking about, as well as the amendments that Angie mentioned, value-based payments and rate standardization, we've also been talking internally with the division and with CMS. CMS has started to have statewide calls and state-specific calls about unwinding COVID flexibilities. Right now, the federal PHE is set to expire on April 16th of this year. We have not had any official word that it will be extended or it will actually expire, but CMS has wants us to use this time to start thinking about unwinding those COVID flexibilities that you may have been using, the division may have been using during the COVID period. A reminder that any of the 1135 only, which would be like your state plan amendment flexibilities, if it's only in 1135 flexibility, it will end with the ending of the PHE. And those flexibilities that are given under Appendix Ks, which are specific to our waiver language, those expire no later than 6 months after the federal PHE. And then if there are multiple authorities, the flexibilities end with the later of the two. And I'm just going to check to see if there's any questions in here. I'm not seeing any questions yet at this time, so I'm going to go ahead and pass it off to Leslie DeGroat, and she's going to give us some updates as well today.
Thank you, Emily. I'm Leslie DeGroat, your division's clinical coordinator, and give me just a minute and I'm going to share my screen. Move something. Oh, I got the ball. Okay. You should be able to see my screen now. And what I'm showing here, well, is something I'd like to tell you about that we're working on. The Missouri Association of Area on Aging, also called the MA4, has a health promotion project. Contracted DMH Developmental Disabilities Service Provider agencies through the project may assist adult individuals receiving Missouri Medicaid home and community-based waiver services and their caregivers to participate in free classes. The classes are focused on helping participants manage health and social needs, decrease stress, and improve well-being. And we're going to drop a link in the chat, and that will provide you a recent recorded overview presentation and slide deck regarding the MA4 Health Promotion Project. And this is what it looks like right here, and you'll be able to go through it and kind of get more information about that. But it'll help people who are living with chronic health conditions and learn how to manage that better and maybe have healthier outcomes. So we're really excited about that opportunity. So you want to move this out of the way. I'm also going to share with you some updated or newer links from the CDC related to COVID-19 that I hope you find helpful. I'm going to go ahead. I already have them pulled up, so I'm going to click on it, and we'll be dropping these in the chat. The first link I want to show you from the CDC is titled COVID-19 by County and can easily show you the intensity of COVID-19 in your community. It is based on hospital beds being used, hospital admissions, and the total number of new COVID-19 cases in an area. This will help you know what type of precautions are recommended by the CDC to take to protect yourselves and others from COVID-19 based on the COVID-19 community level in your area. So I'm going to scroll down here and show you what the levels look like. Low level, you'll stay up to date with COVID-19 vaccines. That's what's recommended, and they recommend get tested if you have symptoms. If your community is at a medium level, you will need to, they recommend staying up to date with COVID-19 vaccines, get tested if you have symptoms, and if you're at high risk for severe illness, talk to your healthcare provider about whether you need to wear a mask and take other precautions. And then at a higher level, all of those previous items apply, and they also recommend to wear a mask indoors in public. And then also just want to reiterate that additional precautions may be needed for people at higher risk for illness. I want to point out that the little blue words here where you can click on links and learn more about information, right here we have at high risk for severe illness, and I already have that pulled up, so I'm going to click on that. Let's see. I want to share that with you, that there's more details that you can look at there, because people with intellectual and developmental disabilities, that puts them at a higher risk for severe illness from COVID. So as I said, this dives further into prevention strategies. For example, if the county level is at a low level, but you or someone you know is at a high risk for severe disease, it recommends having a plan for rapid testing if needed, like having home tests or access to testings. Talk to your healthcare provider about whether you are a candidate for treatment like oral antivirals. Here, I'm going to scroll down. Or here, maybe that's not the right one. Sorry about that, a little technical difficulty here. Here, I'll go back to that. Ah, here we go. Sorry about that. Thought I had it already up there. Let's see. So yeah, you can also ask your, as I was saying, your provider if maybe oral antivirals will be helpful for you, or PrEP, or what's otherwise known as pre-exposure prophylaxis, or even monoclonal antibodies, which you may have heard of. I want to scroll up to the COVID-19 county check to show you how you can check for your own county. Sorry if I'm making you dizzy. Okay, so right here, I was already experimenting with it. You can click on this right here and click on your state, Missouri, and then whatever county you're interested in, we'll say Buchanan County, and then click go. And it looks like they're at a medium risk. So see, it highlights if you're at high risk for severe illness, talk to your healthcare provider. And then it also gives the other recommendations. So that's a way you can keep yourself informed about what's happening in the community related to COVID. Another link that we were wanting to share is tied, let's see, all over the place here. Okay, it's titled COVID-19 Community Levels, a measure of the impact of COVID-19 illness on health and healthcare systems. And that's just another way to look at community transmissions. And I'm going to make you dizzy again and scroll down. I just love this map, though. I want to show it to you. See, it's got the whole United States, and you can see that some places are quite a few places are at low transmission level, which is, we're being able to experience more freedoms and less risk of getting sick, which is wonderful right now. We do see in the corner of Missouri right here, some of the counties have a high prevalence of COVID and just a few spots of medium, but you can always click on that to just kind of get a little more information. I wanted you to be aware of that resource for your knowledge. And another question that has come up previously is about vaccines. I'm going to scroll up. So get vaccinated and stay up to date. There's a difference between the terms fully vaccinated and up to date. Fully vaccinated means a person has received all recommended doses in their primary series of COVID-19 vaccine. Up to date means that you've received all the recommended doses, but also a booster dose whenever you're eligible for that. So I just wanted to make that distinction. I'm going to scroll down and show you the different vaccine options as well as recommendations for boosters. So if you click on that link, you will be able to kind of look at that. If you haven't gotten vaccinated, or maybe you're interested, or, we are going to also go ahead and drop the Department of Health and Senior Services COVID link in the chat. It's not anything new, but I just want to remind you that it is still there, and they're still there to support people in, staying safe. So you can look at things such as where you can get a vaccine, information about testing, if you need info on how to get a ride to get vaccinated, and just all sorts of information. As you can see from this, you just click on that info and it's got all those different things that you can look at. And another thing I want to remind you about, which I think is just a great service, Station MD. So I'm going to click on this link. We'll drop these links in the chat. So you might say, how do you sign up for Station MD if you're not already signed up? Well, you can directly contact Station MD as the need for health assessment and coordination arises. The link we are putting in the chat will tell you how to contact Station MD, and it just kind of run through right there, and it'll tell you step by step, and they're there to give you support. And I'm going to click on this next thing here. We'll drop that in the chat. Another option is to go ahead and call your support coordinator and request this service be included in your ISP. The link in the chat is for the form that the support coordinator will fill out for this service. So I'm going to stop sharing for right now. I've just got a couple other things. I wanted to bring up, hang on, I lost one of my documents. Okay. I wanted to bring up the following that has come up related to PCR testing. It's from the information that was sent from the Department of Health and Senior Services. After a sharp increase in testing demand during the Omicron surge in December and January, Missouri has been experiencing a dramatic decline in testing the past several weeks. Due to this low demand and increased availability and accessibility of testing resources, the state's at-home PCR testing kit program will be ending March 31st. But don't worry, there are still methods and ways that people can still get free testing. So we're dropping those in the chat. And also, don't forget to use the DHSS link that we dropped in the chat earlier that has all things COVID. That's just such a valuable tool that just make sure you have that in your pocket. And that will have further options for availabilities for testing. Anyway, that's all the information I have at this time. I really appreciate your time on this. It's rainy, but it's still a beautiful Friday morning. And anyway, I will now hand it off to Wendy Witzig, your division's Deputy Director of Community Operations.
Hey, Leslie, before
Yes.
we pass it off to Wendy, sorry, I'm going to jump in here because I did see a question that we're hoping you could help us with, but
Oh, I'll try. Yeah.
yeah, no, you're good, you're good. Is the division requiring their DSPs to wear masks while providing supports? And that may
Oh,
also
well,
be a
that,
Wendy question.
yeah, it may also as well. We aren't changing anything that we're doing now. I know that provider agencies will have their own policies and shape them. We haven't changed any of our particular guidance coming from the division. And maybe if Wendy does feel comfortable chiming in on that, and
Okay.
if I'm not able to answer that thoroughly, we'll get the proper answer.
Thank you so much. So Wendy. I think Wendy's on the line. Okay, while we're working on Wendy getting connected to the audio, I'm going to look through to see if we have any more questions. Lots of good resources and great links in the chat. Thank you, Leslie and Beth. Oh, okay. Beth, we need to unmute Wendy somehow. You can help with that. Wendy, we're looking for you. Nothing like technical difficulties, huh?
Good morning. Can you hear me?
Yay! Yes, we can.
Hey, it's one of those times when you can't text fast enough. So, yes, and Leslie was exactly right with what she said. So we don't have any requirements of our community providers beyond what they establish in their policies that is consistent with CDC guidance. So it might be helpful information for you to know what our habilitation centers and our waiver operated programs are doing if you want to use that as a guide for yourself, but know that that's not a requirement of the community providers. That is just a decision that the division makes as the provider in those cases. Does that answer that question?
Thank you, Wendy.
Welcome. Is there any other questions before I go on?
Yeah, the other question we have, which you might end up talking about this here, but the other question that we have is with returning to in-person monitoring, if we're required to wear masks for those visits.
Okay, so I'll just start with that agenda item. All I was going to do is remind everyone that on April 1st, it's not an April Fool's joke. We will be returning to in-person monitoring, and that applies to all of our units that are doing monitoring. So the requirement for our team members to wear a mask in the home or in the office, if you're going to a provider office when doing monitoring, will be based on that provider agency's requirements, the needs of the individual in the home, the circumstances in the home, if they're immunocompromised, or maybe if they're not feeling well themselves, or the comfort level of our employee who is doing that monitoring. If they prefer to wear a mask, they certainly can do so. Otherwise, they need to follow the policy of the provider and the requirements for that home.
Thank you.
And if there's any other questions around that, just put them in the chat. I've got 3 other items that I will hit on, and then we'll see if there's any follow-up questions. Just wanted to let you know that we're excited that our apprenticeship application has officially been shipped off to the feds to look at, and can you tell I just blanked on who we sent it off to? Angie, help me with that. Workforce Development?
Department of Labor.
Thank you, Department of Labor. So we're hoping for a quick turnaround time on that, but we are very optimistic about getting results back on that very soon. So we'll be able to be working with multiple divisions and departments across the state on developing apprenticeship programs that will help to build a pipeline for direct care professionals and other professions to lead into the workforce for not just our division, but health and senior services and others who need like support staff. So we're really excited about that. So stay tuned for more information on that. Another piece of good news is the MAS, which is an assessment. I couldn't begin to tell you, I hate to use acronyms, but I'm not going to remember what that acronym stands for. It is our MAS assessment, which basically has combined the purposes of two or three of our different assessments that we're currently using. So it will really streamline our process. That has gone out for the first informal public comment through the Secretary of State's office. So if you're interested in learning more about that or making comment, you can go to the Secretary of State's website and look for that. We're hopeful that that will make it through the 30-day process. Then there will be review of the comments that we receive, and it will go out for a final 30-day review. So we are hopeful that that can move through the process quickly. It will greatly streamline the efforts for our support coordinators and our assessors. So we're really looking forward to getting that implemented as well. Last but not least, Beth, if you could put up on the screen, we're hosting the some roundtable discussions across the state about the Missouri quality outcomes. We are hoping to be able to talk with self-advocates and family members about those quality outcomes, get their feedback, get their ideas on what they need, and the information for you to sign up and to be a part of those discussions is on the screen now. Looks like they're all virtual, so it's not too late to join. The last one is tomorrow. I just noticed that the others were in the past, but the last one is tomorrow. And so please, if you're able, jump on and help us with feedback around our Missouri quality outcomes. And with that, I'll hand it back to you, Angie, if there's any other questions in the chat.
Hey, I am looking through. I don't see any other questions for now.
All right. Well, then we can wish everybody a wonderful weekend. Take care.
Thank you all.